Hello, my name is Joanna Injore and I'm a registered dietitian. I've been working in oncology now for about 16 years, both in the NHS and privately. I currently work in my private practice, Joanna Nutrition, supporting cancer patients during and after treatment, and also for Macmillan Cancer Support. Today I'm going to be talking about eating well during bowel cancer treatment and beyond. Today I'm going to just give you an overview about what food to include in your diet after treatment, have a look at common sort of bowel changes and how to manage them with diet, take a look at diet post-surgery, and also talk a little bit about fatigue and how to maybe manage this with your diet, and some tips for sleep as well. And finally, maybe discuss about recommendations for cancer prevention. Okay, so first of all, what makes up a healthy diet? So you may have been familiar with seeing sort of the plate model or the eat well model, and this gives us a guide of the different foods that we need to include in our diet. So the plate model is also available in different formats. So you have some for vegan diets, for African and Caribbean diets, for South Asian diets as well. And these will be reflective of the foods that are in those diets. So do have a look at those other models if you feel that's suitable for you. So this plate model gives you an overview of the different food groups, as I mentioned, that you should be including in your diet. And these food groups are your fruits and vegetables, your carbohydrates or starchy foods, your protein foods, your dairy foods, and then finally sort of your fats and maybe sugary foods as well. So first of all, let's go into a little bit detail about these food groups. So we have our protein foods, and these include things like your meats, your chicken, egg or fish, or soya or plant-based products like corn or pulses or nuts or tofu. So these foods are really important to include to make sure that they give you a bit of energy, and also your cells need them to be healthy. And you need to roughly have about 2 to 3 portions a day. So the next group is your fruits and vegetables, and all fruits and vegetables are included in here. And the aim is to have about 5 portions of fruits and vegetables a day if you can. And I know that if you're maybe being asked to follow a low fibre diet, you might be having a bit less than this, and that's okay. Do follow the advice that you've been given. As I said, all fruits and vegetables included in here. Your tinned, your frozen, your dried fruit, all fruits and vegetables are included. And as I said, try to include some of these during the day, because we want to make sure that you're getting enough fibre, which is important for your gut health, but also for vitamins and minerals, so try and include those. The next really big group is your carbohydrate foods. So these are your starchy foods. So these can be things like rice, potatoes, cassava, couscous, plantain, bread or cereals. If you can, try go for the whole grain versions with your rice or the flours that you're using in maybe roti and things like that as well, because the whole grains will have a little bit more fibre as well. So having these is really important to have sort of at least at each meal, so breakfast, lunch and dinner, have a source of carbohydrates. And these are again important for things like B vitamins and also to provide energy throughout the day. So next we have our dairy products, and this includes milk, cheese, things like paneer or lassi, and also your plant-based versions as well. So you may be, if you're following a plant-based diet, you may be having plant versions of your dairy products. One quick tip is, if you're having a plant-based version, make sure that you're choosing ones that's not organic, because organic versions will not have added calcium or minerals added to them. So just go for the standard versions if you can. And calcium and other minerals are really important that you get from your dairy products. So do try to include sort of 2 to 3 portions a day of these products in your diet. And then the last group is the smallest group, which is our fats and our sugary foods. So you need to include some fats in your diet, and included in this are some healthy fats like rapeseed oil or olive oil or ghee, and also things like the healthy fats you get from oily fish as well. So you need to have a small amount of these in your diet, but also included in this group are things like sweets and crisps and chocolates. So that's not to say you're not to have any of these things in your diet at all. You know, you can have a small amount, but just not regularly. And actually, just to be aware that sometimes, if, for example, during treatment you're struggling with your appetite, or you might be losing weight, you might be asked to increase some of these high-calorie foods in your diet. And I know that feels like it's going against the standard advice, but in these circumstances, it might be beneficial just to give you those extra calories for that short period of time. Okay, so we've just talked about different food groups to include in your diet, but we also need to know about the portion sizes, and portion sizes can be really tricky to know how much we should be eating. So I've got a really good quick tip for you, is to use your hands to help you, to guide you about what portions you should be having. So first of all, these are all based on one portion. So first of all, things like chicken or fish, a portion is the whole of your hand is one portion. Things like meat or beans is what fits in the inner palm of your hand. Your carbohydrates portion, so like your starchy foods like rice and potatoes, etc., should be just a little bit bigger than your palm. Your vegetables should be kind of like 2 cupped handfuls. Fruit is what fits in the inner palm. So things like raspberries or berries or blueberries is what fits in the inside of your palm. Cheese is sometimes really hard to gauge how much you should have, but it's about 2 finger whips is a portion of cheese. And fats is the smallest portion you should have, and it's about the tip of your finger. That's about a portion. So hopefully you find that helpful, because we don't want you measuring things. So having your hands, they're there ready to use, you can help you to guide you what portions to have. Okay, so we've just talked about the general recommendations for healthy eating, and this is actually what we all should be eating. However, I know after cancer treatment, things, eating can be a little bit different. You may take you a little bit of time to get your appetite back. You might have side effects of treatment or you might still be recovering from surgery. So or also with bowel cancer treatment, you might still be asked to sort of limit your fibre intake. And you might need to kind of lower your fruit and vegetable intake for a short period of time, and that's okay. Continue to follow the advice you're given. One thing is that we haven't spoken about is about fluid. Make sure that you keep up with your fluid intake. Keeping hydrated is really important. It really helps to keep your bowels functioning and working really well. Helps to keep you hydrated so you're not dehydrated during the day. So just keep up with your fluid intake as well. And another quick warning is about supplements. So we talked about different food groups and how you get different vitamins from different foods, but you don't need to have really high dose vitamin supplements. You might be asked from your doctor or dietitian to take supplements, but do this under advice only. Don't take, avoid taking high dose supplements, because they can be dangerous and they can also interfere with treatment, and they're not necessary. After bowel cancer treatment, you may experience a few side effects that affect your bowels. Sometimes you might have loose stools or diarrhea. You might get constipation or urgency, which is like needing to go to the toilet more quickly, more often. Or you might get wind and bloating. So there are some things in your diet that we can do to kind of reduce these symptoms and manage them better, which is what I'm going to go on to talk about next. So thinking about loose stools, you might experience loose stools, and there are a few things that you can do that might help with managing that. First thing is kind of keeping your fluid intake up. We need to aim for at least sort of 2 litres of fluid a day, and this may be a bit different if you have a stoma bag, so follow the advice you get from your team about that. But our main aim is to avoid dehydration. One good quick tip to avoid dehydration is to check that your urine, when you go into the toilet, going for a wee, that it's pale yellow coloured, and that is a good indication that you're not dehydrated, you're drinking enough. If you're having sweeteners or caffeine or alcohol, some of these can stimulate the bowel. So have a look at your diet and see whether you're having a lot of these things and maybe cut back a little bit. Like for example, with caffeine, we usually say aim for only 2 to 3 cups a day and don't have any more, because that can stimulate your bowel and make you go to the toilet a bit more. The same with fruit juice. Fruit juice is also can stimulate the bowel, so just stick to say 150 ml of 1 small glass a day. And also make sure your team is aware if you're having loose stools and diarrhea, because they may be able to recommend some medication to help manage that as well as the diet. Okay, so thinking about urgency and needing to go to the toilet more often. So after bowel cancer treatment or surgery, it does take a bit of time for the bowel to settle down. So give it time, it hopefully will improve. But there are a couple of things you can do to help. First of all, check you're having regular meals, because it's important to have regular meals, because that also helps to keep your bowel habit a bit more regular as well. It's also worth remembering that our gut is affected by how we feel and our emotions and our stress levels. So, do develop sort of good relaxation techniques and get help with this if you need it as well. Because after or during bowel cancer treatment is very difficult and it's a stressful time. So if you need support with managing those emotions that might be around at that time, then please do get help and ask for support with managing that. Another thing you can do is keep a food and symptom diary, and this just involves, writing down what you're eating against any symptoms you're experiencing. And this can just help if you think there are any things that are causing you to go to the toilet more often. And then you can take this to your medical team or your dietitian so they can help support you and see if there's any connections with what you're eating and any symptoms you're experiencing. But one thing you mustn't do is restrict lots of foods in your diet on your own. Do get help, because we need you to have that balanced diet and getting all the nutrients you need. So don't restrict anything on your own, and get support with this if you really need to. Constipation is when you find it difficult to go for a poo, or you find you're going less often compared to normal, or you feel like your bowel hasn't completely emptied. So there are a few things you can do with your diet and lifestyle to help with this. First thing is fluid again. Make sure you're having, your 2 litres of fluid a day, because having fluid in your diet will help everything to pass through much more easily. Aim for regular meals again. Having regular meals will just help to create that regular bowel pattern. Have a look at your fibre intake. If you haven't been told to restrict your fibre intake, are you managing 5 portions of fruit and vegetable a day? Could you maybe have a look maybe at breakfast? Maybe you could add like an extra portion of fruit with your breakfast. Maybe at lunchtime, could you add like a bit of salad if you're having a sandwich? And at dinner time, check, are you having, half your plate full of fruit and vegetables? See if you can add a little bit into your diet. And also things like whole grains are good to include because they're good for fibre. So you could have whole grain cereals or pasta or rice or flour, like if you use for chapati flour, for example. So think if you can add some whole grains in. Thinking about fibre, it's really important if you're going to have more fibre in your diet and introduce more foods, you might need to do it very slowly and gradually, because you would need time for your bowel to adjust, and you need to make sure you're having enough fluid so everything passes through very easily. Also, another food to include is some oat-based foods, so things like porridge or crackers, oat-based crackers or biscuits, because research shows that oats are quite good for constipation. And another thing not to do with food at all is keeping active. Keep moving, because that really helps to stimulate the nervous system and helps the muscles and the nerves in the gut to work better and helps with constipation. So gentle activity is great to help that. And also another thing not related to diet is toilet position. So best position really for going for a poo is having your knees bent, maybe sitting on a small stool. So thinking about your toilet position is helpful. There is some research to show that adding flax seeds to your foods can help with constipation. And this can be done by adding like a small teaspoon to like yogurts or cereals, but this has to be done very slowly and usually under advice of a dietitian. You might experience some wind and bloating after cancer surgery or during treatment or after treatment. My number one tip actually hasn't got anything to do with diet at all, but it's all about just making sure that you eat slowly and chew very well, chew properly. So, thinking about when you're eating, keeping it a really relaxed environment, taking your time to eat so you're eating well, and maybe, in between mouthfuls, putting the fork down so you're really taking your time with eating. What this does is prevent you from swallowing lots of excess air, which can add to bloating. So that's my number one tip, is look at how the speed you're eating and try and slow down. Some people find things like peppermint teas helpful and calming and help with bloating symptoms. That's something that's quite easy to introduce. And also things like oat-based foods like porridge or crackers or biscuits can sometimes help as well with bloating. There are some foods that might be good to avoid, things like sweeteners that are found in sugar-free gums or in fizzy drinks, because these sweeteners sometimes can are poorly digested in the gut, so they might lead to sort of wind and bloating. And there are some foods that may increase your risk of bloating, and these common culprits are things like cabbage, cauliflower, onions, garlic, sweet corn, broccoli, Brussels sprouts, leeks and pulses and beans. But please don't restrict these foods unless they're a problem for you. And if you're finding that you have to restrict lots of food, that's when you need to seek advice from a dietitian or from your medical team. So some people may need to have a stoma bag fitted after or during bowel cancer treatment. There are two types based on where in the gut they're positioned. So you have a colostomy or an ileostomy. A colostomy is where part of the colon or the large bowel is brought out to the stomach so that your waste or poo is collected in a stoma bag. So the diet that you would need to follow from this, you might be advised initially to follow a lower fibre diet. This is just to allow the bowel to recover and rest. And so you might need to cook your vegetables and fruit initially for a short period of time. But the overall aim is to return back to a normal diet. Unless any specific foods are causing side effects. You want to make sure you're having your regular meals because that helps to keep your stool output regular and avoid excess wind. Keep your fluid intake up, like we've talked about fluid, trying to make sure that that keeps everything moving along well. And really, as I said, we want to get back to that normal diet again. So keep trying food. So you might find initially something may not agree with you, but if you give it a try a few weeks later, you might find you'll be able to eat that again. So keep trying to go back to that normal diet. So an ileostomy is where your small bowel or your ileum is brought out to the stomach to collect the waste material again in a bag. The stoma bag output, so what's in the bag, will actually be a little bit more watery or sloppy. And this is because your water's not being absorbed in the large bowel. We're kind of just going a little bit further up. So again, the dietary advice is to follow a low fibre diet, and you want to aim to reintroduce some fibre back in quite slowly to your tolerance level. And that depends on everyone. Everyone has their own individual tolerance level. Again, we need to make sure you're having regular meals and avoiding large gaps between meals because this avoids excess air to build up in the bag. So that's really important. And also what's really important is to eat slowly. So you're chewing really well and eat slowly so you're not swallowing lots of excess air. Keep up with your fluid intake again. As I said, thinking about what good, when you're drinking well is when your urine is sort of pale yellow coloured. So you're drinking well then. Also, think about when you're thinking about drinking, try not to drink with meals because that can make you swallow lots of air. So try maybe just in between meals if you find that's a problem. There are some foods that are sort of higher in fibre, a bit more difficult to digest. So things like with skins on, like potatoes with skins, sweet corn or nuts or celery. And you might find that some of these foods might be a bit difficult for you to digest. But the key is to take it slow. For you, they may not be a problem. For someone else, they may be. You need to just think about trying one food at a time and just taking it at a time and seeing how you manage with that. Everybody's different, so it's, take your time with that. If you find you're restricting lots of foods in your diet or really struggling with getting that variety back in, then do speak to your medical team or dietitian who can give you some further advice because we really want you to get back to that good, healthy, balanced diet and for you to enjoy your foods as well. Sometimes you may struggle with eating after treatment or after surgery, and this can lead to weight loss. There are a few things that you can do to kind of help and optimise your diet during this time. One of the first things is have a look at your meals and maybe go for small but more frequent meals, like 3 meals and a couple of snacks in between, because that might be much easier for you to manage. Make each mouthful count. So you might find you might need to add a little bit of extra calories or protein, things like butter or ghee, or to your meals, or cream or cheese, just to add a few extra calories to each mouthful, just to kind of boost your calorie intake. Also, just go with foods that you enjoy. Make sure that you're kind of going for the choices that you do feel like eating to make the most of your appetite and to stimulate your appetite. And that's the important thing is to keep eating and keep having small portions because you need to keep eating to keep stimulating your appetite. So keep having small amounts. You might find you might need some extra nutrition with supplement drinks that your doctor or your dietitian might prescribe. And there are lots of different types of supplement drinks so that are on offer in different formats. So if you are prescribed this, persevere with them and maybe try a few different types just so you can find something that you like. And this might just be needed for a short time just to pick your eating up while you're struggling. Also, just let your medical team know straight away if you're struggling with eating, or have a poor appetite, or experiencing weight loss, so that they can refer you on to a dietitian and they can get support to manage this that you need. If you're looking after someone that has a poor appetite, try to keep the environment relaxed, because that does help the person with a poor appetite feel less pressured with eating, and that can really help to kind of prompt them back with their appetite. As with weight loss, people can also gain weight during treatment, and this can happen for a number of reasons. For example, being less active during treatment, or feeling more tired or unwell, so that means that you kind of reduce your activity level naturally. Sometimes medications can make you feel more hungry, or maybe reach for more of the sort of high-calorie foods, or maybe due to stress, or may simply be just a way of managing kind of the treatment side effects. So there's lots of different reasons why you may gain weight during treatment. First of all, give your body a chance to recover, and take your time to get back to normal. Don't be too harsh on yourself. Do give yourself that time. Don't make drastic changes either, like cutting out whole food groups. Just focus on maybe getting the portion size right again, and getting the balance of all the different food groups that you need. Another thing is about getting active, trying to get moving again, just reducing the amount of time just sitting at home, maybe doing a bit more walking if you can, or doing a little bit of gardening or housework. Just start to get moving, and you can build on this. Fatigue. Fatigue is one of the most common issues during or after cancer treatment, and it can range from feeling tired to really exhausted and needing to rest in a bed or a chair for most of the day. And first of all, if you're experiencing this kind of fatigue, really this kind of lack of energy, please do speak to your medical team so that they can check that there's nothing that could be causing this low energy levels. They can do blood tests and they can look at your medications. So first of all, please do discuss it with your medical team. In terms of diet, there are a few things you can do. First of all, make sure you're eating well. You need to eat regularly to support your energy levels. So make sure that you're, aiming for those breakfast, lunch and dinner, and you're eating regularly. And a mixture of foods, of all the different food groups. You're getting enough carbohydrate, enough protein, enough fruit and vegetables. Also keep hydrated, making sure that you're not getting dehydrated. Well, because if you are dehydrated, it can add to lower energy level. So make sure, when you go into the toilet and go for a wee, that your urine is like pale yellow coloured, so you're not getting dehydrated. If you're finding that you're too tired to cook, try and make the most of the days where you have got more energy, so that you can maybe cook an extra portion of food, or maybe ask for friends or family to help to provide some food. Or you could try sort of pre-chopped vegetables that makes it easier with cooking, or you could occasionally go for sort of a healthier ready meal and maybe add an extra portion of vegetables with that as well, just on those days where you're feeling really tired. But the most important thing, as I said, eating regularly, because that's what's going to give you your energy levels. And also another thing is about keeping active. I know it may feel like you're going against your instincts when you're feeling really tired to go and do some movement, but having that routine and keeping moving can actually really help boost your energy levels, and it's also really good for sleep as well. It'll help to kind of get you that natural sleep rhythm too. And as I said, having a good sleep routine is also important as well, which I can talk about next. Here are some of my top tips for helping to get a better night's sleep. Have set wake up and bedtimes, and wake up at the same time every day, even on the weekend, and try and go to bed at the same time every day as well. That helps to set that natural sleep rhythm, so your body kind of knows what to expect. Avoid watching TV in bed if you can, because that can kind of stimulate your mind, and that using screens before beds can interfere with those natural sleep rhythm. So if you can, avoid having screens on sort of 30 to 60 minutes before bed. Keep a little bit active during the day, and moving can help stimulate your sleep rhythms better, and even better getting some natural sunlight as well. That's also useful for setting those natural sleep rhythms and movement, and kind of making you feel ready for bed in the evening. Also look at your sleep environment. Try and keep it really comfortable. It doesn't need to be too hot or too cold, just a little bit on the colder side, so that you've got a really good comfortable environment for sleeping. Also, that's quite important if you're having sort of hot flushes as well. Just keeping it a bit of a cooler environment will help with getting to sleep. Things like caffeine, alcohol or nicotine can also be stimulants, so try not to have those before bed, too close to full bed. And finally, avoid having a large meal before bed. So, give it a couple of hours before you go to sleep after having your meal, just so you've got a bit of time for your food to digest and it doesn't feel too heavy. Making a few changes to your diet and lifestyle can reduce your risk of bowel cancer and prevent reoccurrence. The World Cancer Research Fund produced a systematic review of all the evidence related to diet and lifestyle and have some recommendations specifically on bowel cancer prevention. One of the first things they recommend is including high fibre foods. High fibre foods are things like your fruits and vegetables, your beans and pulses, but also your whole grain foods as well, like your whole grain pastas and rice and cereals. All adults should aim to have 30 grams of fibre a day. So this will be your 5 portions of foods, fruit and vegetables. So do try and aim for that. And this helps by having more fibre in your diet. It helps food to move through the bowel more quickly and also provides vitamins and minerals which can help protect cells from damage. We talked a little bit about whole grains. Trying to swap out some of the carbohydrate foods for whole grain versions like your bread or your rice or your flour. Try and using a mixture of whole grains in there is really important for having a little bit more fibre. And also research suggests that bowel cancer risk decreases by 17% for every 90 grams of whole grains you eat, which is roughly about 3 portions a day. And this helps because whole grains contain more fibre and also phytochemicals which can prevent cells from lots of damage, so they're really good to include in your diet. It's recommended that you limit processed meats and red meats. Processed meats are things like ham, bacon, sausages, hot dogs, chorizo, as much as possible. If you can limit these foods as much as possible, that's advised. And try to limit red meat, so aim for no more than 3 portions a week. And red meat are things like pork, beef, lamb, mutton, goat. Keeping active is also advisable. People who are more active do have a lower risk of bowel cancer and reoccurrence. So aim for 30 minutes of exercise 5 times a week. And this can be broken up into small chunks to make it more manageable, especially if you're new to exercise. And it's important just to keep moving, keep active, spend less time sitting if you can. And this helps because being active helps food to pass through the digestive system much quicker. So harmful compounds are removed quicker. It also helps to keep your weight stable and healthy because we know being overweight is linked to quite a few different types of cancers. And this works because when you're a healthier weight, it keeps your hormone levels better controlled as well. Alcohol. For cancer prevention, it's actually advised to avoid alcohol if you can. But if you do drink, try to have alcohol-free days in the week where you don't drink at all and don't exceed the recommended 14 units of alcohol a week. And alcohol is a risk because it's broken down in the body into harmful substances, which if they're produced when they're broken down in the body, can be harmful and increase risk of cancer. And we've already talked a little bit about healthy weight, but keeping a healthy weight can reduce your risk of a number of cancers, as well as reducing your risk of type 2 diabetes and heart disease. And this helps because being a higher weight is linked to insulin resistance and inflammation, which does increase your risk of cancer. So trying to keep to a nice healthy weight is advisable. Thank you for listening. I hope you found that helpful. If you want some more support and information, please go to the Bowel Cancer UK website.